My guest has spent her career connecting communities to the care and resources they actually need. Listen in to hear how she thinks about health equity work in today's political climate, what it means to build cross-sector partnerships that last, and why knowing your anchor is the key to staying grounded no matter what's shifting around you. You're listening to the PHEC Podcast, episode 456. Welcome to the Public Health Epidemiology Conversations Podcast, where we have honest conversations with public health professionals who are creating meaningful impact in communities around the world. They know that the field of public health touches everything. I'm your host, Dr. Charlotte Hughes Huntley, and today we're exploring the fascinating journey of our guest and diving into another conversation that bridges different perspectives with the practical wisdom you need to fuel your impact. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, workshops, and also trainings, ultimately helping our clients communicate their health information in plain language to their community partners, as well as the broader communities they serve. The support we provide often falls in the category of strategic planning and sometimes capacity building. It just depends upon the needs of our clients. So please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to also support your organization. The links will be provided in the show notes. I am very excited to introduce you to my guest on this episode. My guest is Vanessa Guzman. She is a biomedical engineer and a returning podcast guest. Yes, she's been on the podcast before. Her work sits at the intersection of community health, value-based care, and women's health equity. In this conversation, we explore how she approaches health equity in the shifting political landscape that we're in, why specificity and deep community connection are essential to driving real outcomes, and how cross-sector partnerships strengthen the work that we do, and what led her to devote an entire organization to women's health. You'll walk away with a clear framework for staying grounded and building work that lasts. Let's connect my conversation with Vanessa right after we highlight our sponsor for this episode. Public health is about connection, and now you have a space built just for that. The PHEC Podcast Community app is where public health professionals come together to collaborate, share ideas, and support one another. Inside, you'll find exclusive events like Power Hour, which is our virtual co-working event. It helps you connect with others and boost your productivity. You'll also have direct access to conversations with other public health professionals from around the world, and even guests from previous podcast episodes. We're more than a podcast. We're a thriving community. Be a part of it. Download the PHEC Podcast Community app today and join us. Well, hello, Vanessa. It's good to see you again. How are you?
I'm good. Thank you for having me again. It's so nice to see you and catch up today.
Yes, welcome back. We were chatting just a little bit right before I hit record, and this is just going to be a fun catch-up conversation. At first I said, imagine that we bump into each other at the mall and we're going to catch up, and I'm excited to make it a conference so we can be a little bit more professional. So maybe, but
Absolutely.
I'm looking forward to this. Now, of course, I'll make sure that we have the link to your previous episode on the podcast so that people can go back and listen. I think it's always nice when we have a guest on and then some time passes and then we bring them back and just have a catch-up conversation. It's just amazing to hear the differences. And we're both trying to remember, it's been about 2.5 years.
Yeah, I was pregnant with, I think, my twin boys who are now fully grown, being potty trained at the moment. So talking of evolving worlds, all of our worlds have changed quite a bit since we last connected.
Yes, indeed. Well, let's start off with you just introducing yourself. Tell everyone a little bit about who you are and what you do.
Well, let's start with the professional component. Vanessa Guzman. I'm an engineer, biomedical engineer by training. I'm also the CEO and president at SmartRise Health and co-founder at AJS Health. Both organizations are really a consulting and enabler of value-based care initiatives, equitable care, and community-based initiatives. So with the goal of really engaging communities so that people become activists of their own health. And I proudly say that ahead of World Health Day, right? Since it's such a big deal for me that we all stay healthy and have the best quality of health throughout our life path, throughout our journey here on Earth. So that's the Vanessa professional. And then I'm also a mom and wife I have 3 young kids, a 3.5-year-old girl and 2 boys that are just over 2. So my day is busy to say the least, but it's full with gratitude for sure.
Wonderful. I definitely have some questions to dive into in just a moment, but before we do, and I know we've had this conversation a little while back, but just as a way of reflecting, it's always nice to go back and reflect over kind of how you got to where you are right now, because I know someone listening might think, oh my gosh, that's amazing. You're running these businesses. And I know from experience, there's so much that happens behind the scenes to
So
getting
much.
you where you are. So, do you remember when you initially thought of public health as a career or doing this health equity work? What time did you start connecting those dots?
I started connecting those dots early on in my life as a child. I just didn't have the words for it, but I was a people animal lover from as early as 6, 7, from what I remember. But I always also knew that there was more than what I was exposed to. I'm the daughter of Dominican immigrants, so grateful for that experience, for that culture, for everything that it taught me. It taught me finding a way to everything, right? Because there was just things that we just didn't have, or many things that we did have, right? And so it showed me gratitude, but also the fact that health, especially, was different and looked different for everyone. And what some folks said, oh, it's missing. It wasn't really missing for us, right? Like I was a Medicaid recipient until the age of 21. So when I hear terms like underserved or that population, right, is marginalized, they're at risk. And it's like, well, those are terms I wouldn't describe myself as belonging to that group for such a long time. So there was that. And then there was the health of my parents. My dad, unfortunately, has Lewy body dementia, and he also has cancer. And throughout the years, obviously that's happened in the last 10 years, for me, that has become a mission of how do I find a way for different communities, for my own parents, for my own family, because I was designed a certain way and positioned in a certain career for a purpose, for a reason. So, like, how do I use what I'm really good at and combine that with the family that I was born into and then manifest that? And so here I am.
I think it's interesting how you say the words that are used to describe your community, that's not really how you felt or how you would describe yourself. And I've heard that it's reflective in my own experience, in my own community, but also in my clients. I serve a lot of tribal nations, and that sentiment is strongly, I've heard it multiple times. Like those are not the words that they use to describe themselves, and that's not their experience. And so just come back to that, I'm pretty sure. But that's just a very strong that stood out to me as you described that.
Yeah, thank you.
I think of, yes, we've had these experiences, but that's not how we necessarily describe our experience.
Absolutely. I think there's the external behaviors and perhaps resources and how we use resources as a community. And then there's the self. And that's much more internal, much more intimate, much more depending on the person.
Yeah.
And I think in the last year, my biggest experience has been how do I connect with people, with community so that resources or tailoring communications and marketing and talking about health is a very personal affair rather than this blanket statement of, oh, we need to improve health outcomes for different populations. That's the blanket statement in healthcare, right? And the economics behind it. We're trying to solve a problem that really goes back to fragmentation of how in America we've designed healthcare delivery, health plans, and payment models. That's very separate than what people need to survive, which for me, healthcare is at that level, is what keeps us alive.
I agree. I know that a lot of what we use is a strengths-based approach when we talk about representing communities. And instead of talking about what's wrong, not that we ignore it, but we also lead with what really works well, because these communities we've been historically loved, historically cared for, despite these other words that describe the community, which are
Right.
all true. So, at any rate, let's talk a little bit more about what you're doing now and maybe fill in the gap of how did you start this business? Did you just decide all alone that's what you wanted to do, or how did you end up doing
It
that?
was a leap of faith. I was an executive at a large academic medical center and the largest in New York. And I used to oversee quality and all of our network of providers and hospitals at the time. But the last 2 years of my tenure there, it was like I need to do something beyond, right, the day to day. So it was a very whisper and then it became louder. Toward the end, you really need to move on and do something that's really purposeful and really uses all the masterpiece that I learned. I mean, serving my community in the Bronx is probably like still one of my proudest and loving moments. And the mentors I've had there are just amazing, still my mentors today. But I had to take that now. Like now I had this huge asset that then I had to grow into and scale. And of course, it was at the very beginning of COVID. So it was just a very hard decision for me to leave something that felt secure to something that was so uncertain in the middle of other uncertainties that were happening at the same time. But I remember submitting my resignation letter a week before New York was declared as the hotspot, right? The epicenter. And then I had to make sure I didn't look back after I made that decision. And then SmartRise was birthed a month later. And it has allowed me to scale and be very innovative and creative without the cast of a larger brand, which offers a lot of risk, but also a lot of flexibility and expansion within me. And I've met the best of customers in that journey, a lot of teachers along the way, but also the best people like yourself along the way.
Oh, thank you. I am remembering those moments because I started consulting a few years before the pandemic hit. So officially 2017. But I remember that moment you just described because that was when I worked a full-time job and I ran my business for a while.
Right?
And I
It's
thought it
hard.
would just stay that way all along, but the business really started to take off. And it was in that moment, like right before the shutdown. I
Hmm.
had left my full-time job and like you talked about the security, returned all that equipment. And then like a week later, the world
Right.
shut down.
Right.
And I was like, oh, well, we're in
Did I make
this
the right
now.
decision?
But tell us what SmartRise is.
Yeah. So we work with health systems, health plans, pharma, community based organizations. Think of the full spectrum of healthcare and community and digital. So, companies that work in some shape or form into delivering care for communities and patients and people. And we devise and design their strategy toward that delivery of care. So, if you're a health plan and you have a cohort of members and you need a strategy that focuses on higher quality of care, but also embedding, let's say, the CMS 2027 guide that just came out in the last week. And you need that integration. You need a plan that SmartRise helps devise how to operationalize specific guidance, policies, regulations into what your core competencies are as a health plan or a health system. Another common use case is that we work with community-based organizations in meeting the gap in working with health systems toward meeting specific health outcomes or initiative like food as medicine, which is a big partner of ours through Senna Health. So we basically help organizations connect the dots between their core competencies, what the market demands from it, and making sure everyone follows a same team mentality in doing so that we can achieve those outcomes or those goals that we all set forth.
So are your clients mostly healthcare organizations?
It's a combination, actually. So we have IT data, which
Mhm.
is about 20 to 30% of our customer base. Then the other is healthcare, but within that health plan, health systems, all that. And then it's probably like another 20% community based care. But they all connect in some way. The common denominator is that we also work with HR and employers and marketers for other non healthcare organizations.
Yeah, I asked that for just a couple of reasons, just clarifying it in my mind. I'm thinking about how you're absolutely doing the work of public health and how public health
Yeah,
overlaps so many industries.
absolutely.
And it's this interconnectivity that makes us strong and
Yeah.
helps us to really be able to do the work. And what you just described is a perfect example of that, where you are really intertwined. There's no clear line where it divides one industry or the other. It's really so intertwined.
Yeah, absolutely. I think the cool thing about my job every day and my team's work is that we fit into pretty much any vertical, right? Following a consistent methodology that positions us as all interconnected, as you mentioned, but
Hmm.
also from a place of oneness versus scarcity mentality, which for me is what's going to change our world, right? It's what's going to evolve us as humans, right, in the right direction. Fits into any vertical. And I think for us specifically, we're focusing on public health because it is such a fundamental need for humanity at the moment. But otherwise, if it's anywhere.
Yeah, I agree. I like that. So I'm curious, since you and I last had a conversation, we've had a big change in our political administration here in the United States. So in 2025, with the Trump administration and all of the chaos and confusion
Right.
and shifts and things that have happened as a result throughout the year and continues to occur, how has that impacted the work that you do? Because you are very, I mean, you're equity focused, equity centered. It is about equity, and everything about this administration has been people dodging that word. There's been whole conversations where businesses that had that in the name,
Had to remove it.
having to, exactly. So just curious, how has that impacted your work?
Yeah, I think like everyone else, we had to really, I hope, like many people have had to take a look at what is our strategic stance around that, right? Are we chasing the term or are we chasing the work? We're all in the work, right? So it doesn't matter the terms, it's really the work,
Right.
right? So not much has changed, I'll be honest, right? I
Yeah.
think, call it what you call it. We're still re-stratifying to understand what are the needs of different populations and helping our customers do the same thing. Because without understanding specific needs and like just specificity, let's call it specificity,
Hmm.
you won't solve the right problem, right? So now you're wasting resources without the deployment and having the right folks at the table. Again, your resources won't be leveraged. So there's a lot of efficiency issues there. If you want to reduce cost savings, then you really need to understand specific systems and how those systems talk to each other and how the population is able to absorb it, right? So talking about things like health literacy and being able to talk about hesitancy or confidence in several topics, right? Ranging from vaccines to managing chronic conditions. As you know, those are hot topics right now that are just, a lot of confusion out there. You can effectively address those issues without going deep. So for me, it's about going deep and then connecting. That work has been our number one priority from the beginning of time. And I think it's going to hold regardless of administration. And that's what we build for our customers. We build systems that, regardless of the political stand, regardless of opinions or perspective, we build a strategic stance for those organizations with very specific goals and objectives and systems that have a deep root and therefore not changed by different variables that are less impactful or less significant to the business. And I think that's important for us to just understand our mission and where really the true anchor is, right?
I love your response to that. And I just can't help but think that that interconnected system that you have and that approach, that is such a sustainable, strong foundation. And that is allowing you to really withstand, these really strong shifts. And like you said, regardless of what's happened with this administration, I think the broader lesson for everyone is not just this, but there could be something like a few years ago, it was a pandemic that had everyone
Right.
shaking. Then we have a shift in political administration. A few years from now, it'll be something else. So whatever is happening, it's just about locking arms. I use that a lot, but locking arms with, partners in the work that we do, and that abundance mindset, not the scarcity one, but not the competition, but how can we come together and have a greater impact in the communities that we care so much about and supporting. So I like so much of what you're saying in regards to that. I think there's just a lot of takeaways that I'm seeing and I'm hearing, and I'm hoping the others are are getting it as well.
I appreciate that. I think one thing that we have focused on, because in order to be what you just described, you do need to build bold relationships. You can't do this work alone. This work meaning betterment of humans, improving health outcomes. That's not a solo work.
Mm.
And in order to do that, you really need to be able to build cross-sector partnerships that leverages different competencies, right? So that you're not stuck building it all or trying to figure it out on your own. Because actually, in this case, more is better, but it has to be the right partners, right? It's not just any more. It has to be specific more,
Mhm.
right? And then as we shift into AI and more automation and more of less human thinking in specific areas and sectors that we're used to having more humans involved, especially in those cases, you need to have the right partnerships because building that trajectory, that new way of being, does take a lot of work and resources. So you better do it with the right people.
Yeah, yeah. So well said. I could definitely talk about this all day. Let me take a look at my notes here so that I can get us on track and be mindful of time because
Sure.
this is such a great conversation. Let's talk a little bit more. Well, you mentioned a second company.
Ella is health.
Okay, tell me about that.
Yeah. So Ella is in Spanish means she is. And that company was birthed as a result of a number of miscarriages that my husband and I had, unfortunately, back in 2020. And one morning I woke up and I sat in front of my computer, and that was shortly after the third miscarriage. And I said, why is this happening? It was a very more like, why is it happening to me moment, right? And it's never happening to you. It's happening. Things are happening for you. And that's usually my mentality. But in that moment, I was hurting and that there was a lot of trauma. And then when I asked that question, I was really asking for like something beyond me to answer that question, right? And just like how SmartRise was created, HIS was created because it was like, okay, this is how I was designed. This is the family I was born into. Now I'm trying to figure out and kind of handling these traumatic events that are happening. What does this mean at a higher level? So when you ask that question, I feel the universe does respond in really interesting ways. And for me, it was like, well, Vanessa has the ability of systemizing a lot of because that's a core strength of mine. But also, it was my way of healing, right? It was a way of me also dealing with my own challenges and finding the right resources. And then once I learned those things, I wanted to share, which that's what I always do. So HIS came from that epiphany of why am I caring so much about my health now because I'm trying to have children? Why didn't I care this much when I was 16 years old or 20 or 25, right? Oh, and the answer came quickly because it wasn't that accessible. Health comes to you when other priorities are kind of like feel less fiery, right? Which is what we do when we're trying to manage chronic conditions, right? Everything else has to be lesser so that you can kind of surface. So women's health is no different. It impacts about 50% of the population, yet is so misunderstood and research only started less than 2 decades ago, right? So long story short, we created this company that focuses on working with the same type of customers as SmartRise, but very, very niched in the business of coaching women through a lifelong trajectory, not just during childbearing years, but throughout, so that they are able to understand what their health looks like at any point in time throughout their journey and be able to flag and have effective conversations with different options, different providers throughout a lifetime. So that's HIS in a nutshell. And I think the biggest takeaway that I have from that work is that it helps bring it back home for me because when I connect with other women that are just going through the day to day, it reminds me of, okay, I have so much every day. So it brings me back to a place of gratitude, but also a place that we need to march along and we need to continue doing this work.
Yeah. Yeah. I remember we talked about this a little bit before in our last conversation. I'm glad that you're doing this work. And I actually my mind is ticking and connecting a few things that I have going on now that I didn't before. So we'll have to talk
We have to
about
talk
that a little
more.
bit more. Yeah, for sure. So this is a great time for us to pivot a little bit because I know I need to start to wrap up. So I'm going to kind of pick the last question or two
Yeah.
that I can ask you so that I can also be really mindful of time. I'm going to think about, well, this question, I think you've touched on it, but I like this question, so I'm going to ask.
Yeah.
How do you explain the importance of the work that you do and its connection to public health in plain language? Plain language conversations with your family, friends, in the community. I know you spoke quite a bit
Mhm.
about the communication with the community, really being connected to the community. So, you know, just how are you explaining the importance of this work, this public health work, in plain language in a way that they understand?
I see it as the village conversation, right? If we, as a community, we're a village, we support each other, but to do that in a way that it's really connected and retains a lot of what's unique to each of us, but is expansive to everyone, we must stay healthy, right? And then there's a way, then I branch out a little bit there. But, essentially, the goal is to see our health as the biggest asset of within ourselves. Without our health, we can't be alive. Without the healthiest health, you'll probably have poor quality of life. So then what's the point? I keep it real, right? During those
Yeah.
conversations, depending on how we're discussing it, but that's just the reality. And I think in the healthier state we can give the best to ourselves and we can give our best to our families and therefore grow and become activists of what we really want and what we really need. We will feel much more understood, much more supported. So those are all the terms I use to connect because I feel like, isn't that what we want? Right? Every single day, right? We want to belong. We want all of those things are important, but really at the very like step one is, are you healthy? In order to feel those things, you must be healthy.
I really like that because sometimes, especially with the communities that I live in and that I serve, often if we can frame it to something bigger than ourselves,
Hmm.
then it can really it captures their
Yeah.
attention because these people are my family, my community, and the people that I serve are really focused on their community.
Yeah.
So if they understand that in order to be these things that you want to be for all the people around you, you've got to really take care of yourself first.
Right.
Then a lot of times that really shifts something for people to go, oh, wait a minute, I didn't think about it like that.
Yeah. Yeah.
Our audience is really a blend of students, career professionals of all levels, and people just navigating, the tough times right now that we're in. Is there, any bit of advice or encouragement or any words that you'd like to share with anyone listening? How are you keeping it going? Anything you'd like to share?
Yeah, I think know what your anchor is, right? And by anchor, that means it could mean your faith, it could be your mission, it could be your values, right? For all of you who are listening who are like, I'm not sure of any of that. I don't even know what that is yet. Well, create the space to think about it. I think that is what we talk in like healthcare, business, the strategic stance. That's the term for organizations. But for us as people, it's your anchor. And that's really what sets the tone, your relationships, the way that you figure things out. It starts with your anchor. And then without those resources, really, or that wisdom in place, you aren't able to really follow steps through. Instead, you're going to just ingest everything that's right or wrong in the world, and which may or may not belong to you. That's how I keep rolling, Dr. Huntley. I think for me, that's identifying your anchor. You'll get the wisdom that you need. You'll see the light in yourself and others. I think those steps have been consistent in my life. And however I see myself is generally how I project and manifest, as well as what I'm able to receive. So, for everyone's sake, I try to keep myself as centered as possible because it just benefits myself and my family.
Beautiful. Thank you for sharing that. What is the best place for someone to connect with you?
You can definitely find me on LinkedIn, and you can always email me at vanessa@smartrisehealth.com. I'm very responsive if you have any questions. And we also post a lot of educational sessions. We will be shifting quite a bit between now and Q4 of this year, like through September, October. So stay tuned. There will be more updates to some of the material and just new innovation, let's put it that way, new innovation that we're creating that hopefully by the next time we touch base, you'll be preview to that, Dr. Huntley.
That sounds great. Well, I will make sure to have all of the links to connect added to the show notes as well, and I'll let everyone know how to find the show notes in just a moment. Vanessa, thank you so much for making time
Thank
to
you.
come back to the podcast
Yeah.
and update us. And it's been really nice to catch up with you, and we'll continue to keep in touch.
Yeah, it's been a sincere pleasure. For those of you listening, you have all the productivity and centeredness as you drop off from this session today.
Oh, wonderful. Thank you.
Thank you.
I really hope you enjoyed that conversation as much as we did. The message here is simple. When you know what you're building and why, external disruptions don't get to define you. Whether it's a political administration, a pandemic, or a personal loss, the work remains the same. My guest reminds us that strong partnerships, deep community connections, and an abundance mindset are what move the needle in public health. So, whatever stage you're at in your journey, this episode is a reminder that your anchor matters, and so does the work you're doing every single day. I encourage you to connect with Vanessa and learn more about the great work that she's doing, and you can find links to connect in the show notes. So the show notes page for this episode, which is episode 456, can be found at phecpodcast.com. Once you're there, just navigate to episode 456 to find the show notes. One more thing before we go. Remember that our podcast has an app and private community, which is independent of social media platforms. This is a place where you can engage with public health professionals around the world. In addition to being a part of this amazing community, your membership supports the production of this podcast and episodes like this one. You can download our PHEC Podcast community app in your mobile app store, and it's available for both Apple and Android users. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening. The show notes page is where you'll find links to everything we discussed in this episode. To find the show notes for all of our podcast episodes, just visit phecpodcast.com.